Hi, Grayson.
Hey, Danielle. Good to see you.
Thank you. Yeah, you too. You too. Thank you to everybody who is logging on to join us online as well. We are here to talk about infertility care for couples. This is brought to you by Third Try Fertility, which is a project that Grayson and I have been working on to bring support to the couples going through fertility treatment. So just a little bit about the presentation. These slides are full of information. They're there for your reference. References for information that is not from Grayson and I will be provided at the end, and you're welcome to reach out with other questions if you have them. So my name is Dr. Danielle Eldred. I'm a licensed psychologist and licensed clinical social worker. I have been in the field of reproductive mental health for about a decade. I worked quite a bit with children and then in a hospital setting, worked in a maternal child health unit and really got to see the full spectrum of experiences, the joy and some of the incredible pain that could come. And that sparked this desire in me to work with couples navigating these losses, these challenges, and then into fertility care itself. That brought me back to school for a doctorate where I focused my research on the coping strategies that couples use during their fertility journeys and how that translates into postpartum care and their transition to parenthood. Just really inspired by the resilience and how we can capitalize on those strategies that couples whose relationship navigate those waters well, how we can use those strategies to support couples and make that a bit of a map, a guideway. That brought me with Grayson, who's a wonderful clinician as well, and I'll let him introduce himself.
Oh, thanks, Danielle. My name's Grayson Wallen. I'm originally a Phoenix transplant, but moved to San Diego after graduation and with my master's, and I'm now a certified Gottman therapist as well. And what brought me to working with Danielle and launching Third Try is that in my practice, working with couples, I saw couples down the line after fertility challenge or after fertility treatment all share with me kind of unanimously in so many words, like, we haven't talked about this season. That was a really dark time. That was a really tough time. We got through it somehow. It's in the past, or in so many words, those types of things. And so that led me to start wondering and asking the question of, like, what could be done to help relationships preemptively before they get, 6, 7, 8, or how many years down the line, and they come into a couples therapist office like mine or Danielle's, talking about what they went through sometimes a decade prior for the very first time. And so that's when Danielle and I put our heads together to come up with curriculum and program and ideas of how to help couples based off of research and our clinical insights. And so, yeah.
Yeah, lucky to be partnered with you in this journey.
Oh, thanks, Danielle. Me too.
All right. So really, why did Grayson and I decide to start this project? He spoke really beautifully of the couples that he worked with and kind of seeing how the ruptures that can come up during this time can really linger and have long-lasting effects. Similarly, I saw where there would be couples who navigated with such strength and resilience, and we wanted to put our heads together to see how we could bring that support to all couples going through, all relationships going through fertility treatment. The research consistently shows how important treating the couple together is during this process, really focusing on both partners and their experience. And oftentimes it's really hard to put into practice. And so we're really hoping to be kind of that wraparound, that additional support for you during this time.
Yeah. And so because the relationship is central to how couples move together, or through the family building season or the attempts at that, that really is so important, because beyond this season of challenge, the relationship is there. And this is one season of the relationship that in juxtaposition to other seasons can be really bitter or could be really unifying. And so, the goal, at least for Danielle and I, is to create an atmosphere where relationships can, talk about these lagging effects before they become lagging effects, which is, criticism, avoidance, kind of like a you do you and I'll do me, stay in our lanes, and ultimately get dismissed because couples that are able to talk about crucial issues today most likely are not able to talk about crucial issues tomorrow. And so a lot of the challenges that relationships are faced with today are not necessarily inherently unique or caused by infertility challenge by any means, but it's the lacking of skills or norms in the relationship of how people talk together or don't. And so, we want to bring some relationships so that through the journey of life together, there can be satisfaction and peace and connection.
Absolutely. And, during the family building adventure and all the shapes it takes, right, it can really be one of those opportunities where couples can come together, like Grayson and I have both talked about, but it also becomes one of those moments where there can be a real division of labor, right? Especially when we think about the medical procedures that come with fertility treatment, oftentimes it's the birthing person, that the woman who's going to be pregnant, the person who's going to be pregnant who takes on the medical, all the shots and the procedures and the scopes and all of the medical side. And so they're taking on kind of the more logistical role within that partnership. And oftentimes we'll see that then the non-birthing person, the spouse, the partner, is going to be the one who is taking the charge to hold the hope. And we use this image of the mountain climber, this couple climbing the mountain, to really show this, that sometimes you have one partner who's really wanting to be optimistic and this is going to work and this is going to feel so good, right? And they're trying to pull their partner up the mountain. And then you have the person going through the medical treatment that then is feeling very physically uncomfortable, emotionally, like the hormones that we're injecting in our bodies take us in all sorts of different places too, right? And it can feel very heavy. And to feel this divide, this stretch between the two, it can create or exacerbate that sense of being misunderstood, of feeling alone in this process on both ends, of feeling protective of your partner, right? That you can't share all the things that you're feeling or needing because you want to protect your partner, recognizing all that they're going through or all that they're doing. And so we really want to be able to provide a path for you to come together to be able to speak about and feel understood by your partner, and also speak in a way in which your partner can hear you, so that this journey is one that you go through together, not one that you go through together parallel, but united.
Yeah, that both people are active and engaged and consenting and available, and
yeah, very much so.
Cool. So what happens to a relationship during treatment? You can go to the next slide, Danielle.
Yeah, there we go.
Sweet. So there's lots of signs or symptoms that your relationship could be distressed or need some support. Predominantly, it's just feeling understood. And that's a real challenge for a lot of people, regardless of what, fertility state that you're in, because understanding the other person's perspective is really challenging when you have thoughts that are of disagreement, or perspectives that are different, or underlying value systems that are different, or that you're stumbling upon are different. Maybe they seem similar at the beginning, but now they're not the same. And it's this overwhelming sense of being unnoticed or unimportant. And it's these small little moments that we know in relationships that really add up to big changes over time. And these have to do with, can you get your partner's attention? Can we talk about the things we need to? Can we say that another bullet point on here, we're wondering if our relationship will make it to the end, or we're wondering if we can talk through addictions or avoidance or workaholism, which is such a normal stress response to try and numb out, disconnect, or just like do what you're good at, or do what shows the most promise. And lots of relationships, like they just grin and bear it, honestly, is what I've seen. And it really causes a lot of pain in people. And then you imagine that fermenting over time, that really creates like a tough combo for couples to get past. And so these aren't necessarily like diagnostic, or these are just ideas that Danielle and I have seen in real counseling sessions, real counseling appointments, that couples are oftentimes asking.
Yeah, absolutely. And really thinking about wanting to be the most productive in these conversations and resolving conflict, and having the confidence that regardless of what happens, that you as a relationship will be okay. Having that confidence in each other. So Grayson alluded to kind of relationships during times of stress and some of the things that happen, right? And oftentimes there are challenges that are pretty universal, right? We think about the your way, my way situation, right? And that standoff. We can think about too, kind of what we talked about in the mountain situation, right? This desire to protect our partner, right? So protect maybe as the non-birthing partner, being able to support my wife or my partner with all the medical things and all of the emotional aspects that get exacerbated by the hormones being injected, right? Then I might not share my worries or concerns in order to protect her. Or vice versa, seeing my partner being so optimistic and hopeful and really taking the charge, I might not want to be fully honest with the things that I'm going through, the worries or doubts that I have, in fear of bringing them down from their optimism and hope. And so there can be some good intention behind, but it has the same result of leaving isolated and alone, right? We talk about, one thing that I didn't mention is that I'm an EFT trained clinician, where Grayson is Gottman method trained clinician certified. And so in EFT, we talk a lot about these patterns of attachment needs, and where oftentimes we'll have one partner who in time of conflict really seeks out connection, being able to talk through what's going on, where another partner might need to go away to kind of digest internally or avoid because they just get emotionally overwhelmed. And so sometimes those patterns can really play into decision-making, fertility, around next steps, or when plans change. It just really heightens a lot of the intensity inside, and the dynamics that might already be happening in a relationship, it really comes into play as well. So the good news is that, right, even during times of stress, there's very well evidenced strategies to work through those challenges to come together. Anything else that you would share on this, Grayson?
Yeah, most times it is out of like a goodwill in the relationship. People don't share what they're going through. But, one of the things that I've heard you say, Danielle, often is that shared stress is tolerated stress or metabolized, it leaves the system, it can be reduced. And that's what the Gottmans have found as well. I mean, there's so many things that between EFT and the Gottman method are saying the same exact thing, just with different words. And, couples, stress is normal. Stress happens to people, to relationships, our minds, all that stuff. But it's when you don't talk about it, then it pushes you into a silo and isolating, it can be very isolating. And so, our goal is to try and help couples identify what they can't talk about, and then give them approaches and strategies and skills to actually do that, get the job done.
Absolutely. So another avenue in which we look at this is through the conflicts around family planning specifically, right? So things around like budgeting. How many rounds are we going to go for? How much can a body tolerate? How much can our relationship tolerate? Do we keep going? Do we stop? Right? Thinking about how the medical team might be advising you towards next steps, or maybe towards using donor eggs or sperm, or even a surrogate. Right? So all of these questions can really be areas in which you, as partners, you see things differently, but have to come together on the same page in order to move forward.
Well, and really too, outside of like a clinic perspective, like focusing on the fertility, I've seen lots of couples, have disagreements over like going out to dinner or taking a
Yeah.
vacation or, having time away, doing hobbies, like
Mhm.
joining a gym, something like that, because of the greater financial stress or burden, because then it puts the next round so many months back because of this expenditure. And so,
Yeah.
this is really an all-encompassing kind of culture that relationships are now trying to navigate together, or people are trying to navigate
Yeah.
together.
Yeah, for good reason, because it's so important, right? It's
Totally.
you're
Totally.
pursuing that. You're going through all of this for a big reason, right? Like really wanting to grow your family. Um, and so it makes sense that so many of these other parts of life would be put on the back burner in order, like in pursuit of this one thing. But then we also lose perspective, or we lose access to kind of that full life too. And so figuring out how to approach that with each other and come to agreement is so important. And as we've said before, there are really wonderful, well-supported strategies to explore value systems, to understand where these competing needs might be coming from, to understand what's underneath, maybe a desire to stop or a desire to transition to a different strategy or approach. But when we don't have a way to get to those underlying reasons and to understand each other for the best intention and motivation that we might be in conflict over, it becomes really hard to take those next steps. So having support, having a system to talk through these things can be super important, just to have clarity on next steps. You want to take this one, G?
Yeah. So processing emotion is kind of a loaded subject for a lot of people, because people oftentimes think they're really good at processing emotions. And, when Danielle and I meet with you or people, then you're actually not, or you think that you are and you're actually not. And so, or vice versa, you kind of are really doubled down on the emotions and you can get stuck in them in a way. And so oftentimes, like couples who are in grief, they experience that differently, because grief is an individual process. This isn't, it's something that's shared between two people. But it's also like it shows up very differently, where one person needs to like go and have like a lot of kinesthetic activation to like help their grieving process, not just working out, but like going and doing things that are important, and whereas other people can really have kind of a cathartic experience, instead of like doing things with their bodies, to do things with their minds instead, to like journal or to talk or to share or to go to support groups, things like that. And that can create challenges, because then, if one person is always, doing stuff with their body and one person's always doing stuff relationally with their mind, now you're on two separate pages potentially. But then it also brings up other, reactions that then ultimately trigger like underlying strategies, like Danielle was saying, about how you deal with emotion. And so some people need more activation, more engagement, and some people need to do that internally by themselves so that they can show up to the relationship from a better place. And so this has more to do with like the emotional metabolism and preferences, rather than like, this is what you need to do. And there's so many books out there that will tell you, this is how you grieve, this is how you do this, this is the way that you handle this. And this is where a lot of couples get stuck, is they've like done the curriculum, they've done the thing, and they still are in profound loss because of how traumatic and difficult this journey can be for some people. And so creating space and rhythms and norms inside a relationship where both people can be themselves, share what they need to share, do what they need to do, but ultimately doing that together in a way that feels healthy and supportive to each person, is ultimately the goal. So
For sure. Really being able to appreciate how your partner is coping and seeing their actions for what it is, that it is their way of coping, and then finding ways in which you can metabolize emotionally individually, but always finding a way to come back together too. And what's so cool is that the research shows that the coping strategies don't have to be the same. Actually, there's a lot of benefit in having complementary, like different, but complementary strategies, and making sure that you understand that how you're working together, right? Some partners might do better delegating. They might say, I've got all of this going on, babe, I just need you to take this thing. And that is one way that they navigate the stress, while another, might be, I really need to talk about this, right? So they're understanding where that's coming from. Nobody's trying to burden you. Nobody's trying to belabor a point, but we're all trying to get the support that we need. We then also have a roadmap to show up. And the other piece that's so profound in practice, like in our sessions, but as well in the research, is how important it is for both partners to feel that they can support each other, that they both are the supporter as well as the one who is supported. It doesn't feel good, right, when it feels like you don't get to show up for your partner the way that they're showing up for you. So it's really making sure that there's a path for both to know what support their partner needs and how they can show up for them.
That's huge, because when you are always, it kind of produces like a savior and a victim in a way between the two people. And that's not a fun place to be on either end, like, so, yeah.
Yeah, very much so. Yeah, and then there's definitely some benefit in having cohesion in the relationship during that transition to pregnancy, right? All of this fertility treatment, all of these ups and downs is with the goal of becoming pregnant and seeing that little one into the world. And so what's great is that there's a lot of understanding and recognition of the importance of connection in relationship. The stress that you navigate together during fertility treatment is going to support you during that transition to pregnancy as well, right? In that pregnancy time following fertility, oftentimes pregnancy is perceived as more challenging and risky, but it's also more rewarding. And so if we can talk about the risks and the challenges together, then it also helps to have more access to that sense of fulfillment and reward that comes with pregnancy too. Similarly, anxiety symptoms in pregnancy can be more common, but they're often less intense following fertility treatment. They're subclinical is what we would call it. And so being able to have support in a form in which you can address those effectively together, that's exactly what we're talking about too. The skills that we learn and that we support during fertility treatment translate so beautifully to pregnancy and postpartum, which has its own challenges itself, but really, really important to have those strategies and skills. And there are things that we can do about it.
Totally. Well, and like Danielle and I have been talking about, there's hard skills here. It's not just like existential, like do more, there's like hard corners that couples can go around in activities, like just talking about their days and giving empathy. That's a hard corner to go around, and just saying like, I see that that's terrible, without problem solving, without fixing it, and then getting a chance to then have the roles reversed, where that then is supported, the supporting person then is supported. And so there's also some correlated research in the Gottman's sphere of influence around cis men, especially in heterosexual relationships. They have better outcomes in terms of their health. They have better health outcomes and higher quality sex when their partner feels listened to and understood. And that just goes to show like how challenging it can be for relationships, not to fix problems, but to understand them, to help both people understand each other and get connection and understanding, beyond, fixing or alleviating problems. This is actually kind of the reverse. Just by understanding it and the nature of it, you're actually fixing it in a way. But so many people, I'm guilty of it too, Danielle. I mean, to just fix all my partner's problems would be amazing. So, and you can imagine, right? Like being partner to a shrink too, so yeah.
Totally. Yep. Yeah. And on the other side, right? If my partner would just listen to me and trust that I could figure things out for myself, but just be that sounding board for me, right? Like that would fix all the problems too. And yet it would fix none of them, right? So that's the joy in being able to come together and learn what your partner needs to show up in that way. Because how good does it feel when you're effective, when you effectively show up for your partner? Like that's the best, even if it's not the way that you would want them to show up for you. Yeah, so good.
Yeah, and that's the thing around creating these like little win-wins is that you have to be able to understand what's most important to the other person as well as what's most important to you, before you could ever knock out a win-win. So anyway,
Yes.
we could keep going on this because this is a central part to like what we're doing, and what we've done
It is.
professionally. Yeah.
And clearly we're jazzed about it. Like we could talk about this forever. But as I alluded to before, there are some significant benefits to doing the work early, right? It's easy to think that you can push, that these problems will go away once our little one is here, right? These problems will go away, or the sacrifices that we're making now, like I can put my happiness on the back burner for right now because we're in this together, working towards this family. And while yes, that's maybe true in the short term, I mean, Grayson, your experience speaks to this so well, my own clinical experience as well, that these little, what feels maybe little now is not as little, and it can stay with you for the long term. So there's a real beautiful benefit in doing the work proactively or earlier than maybe you would think you need.
Yeah, well, small problems are easier to fix than big ones, so.
Yes. But hopefully out of all of that, right, that there are very specific strategies that we can learn and practice in order to come together for each of these areas of challenge within the fertility process. And this is just like a brief showing of all the things, of some of the things, not even all the things.
Yeah. Well, there's clearly a lot of things that we can do just by going over this that will make any relationship healthy. And so we have kind of 4 domains that we've seen in our professional capacity that relationships are navigating. There's general stress just by the volume of work or the challenges or the logistics. There's also family planning conflicts, and then individual differences around preferences around family planning and how that is coming into be, and then transitioning into postpartum. These are kind of 4 categories that we found most relationships navigating fertility all seem to face. And they're not necessarily phases like you go from stress into family planning. Like you may have 3 of these, you may have 4 of these, but these are kind of general themes that we've seen. And so we've come up with the bullet points of what we would suggest for each domain.
Yes. Cool. Yeah, so then it's understanding is now the time for support. And generally, Grace and I will say yes. And that's really a decision for you to make with your partner. But most importantly, there is support for you.
For sure.
Cool.
So again, one of the reasons or the main reason why Danielle and I created Third Try was to help couples find effective reproductive support together, because we know and we've seen so many couples kind of go down the individualized treatment route where there's so many individual appointments, and maybe there's overlap because you can attend one another's appointments, but predominantly there's like one patient in the room who's getting the service or support, and there's nothing that bridges the gap between the two. And so we have workshops and resources to help strengthen relationships during this time for the intended outcome of being confident and connected together. And so that's our intention. And we have a website and an interest form if you're interested in more information or connecting with Danielle and I, or you're needing couples therapy services, you're more than welcome to reach out through there. We can get you squared away. And then, Danielle.
Yeah, and then this is just, like we said at the beginning, we want to make sure that the information we're bringing is accurate, updated, well-researched. And so these are a number of the sources that we pulled from. We're just so glad and grateful that you chose to spend this half hour with us. Please reach out, as we said, and really hoping you a journey together through all of this. Thank you so much.
For sure.